Brought to you by Agilus Diagnostics.
हेल्थ टेस्ट की बात आती है तो मैं भरोसा करता हूँ इंडिया लार्जेस्ट डायग्नोस्टिक्स कंपनी एजिलिस डायग्नोस्टिक्स। खुद को टेस्ट करते रहो।
I am here to give you some very important tips so that you can keep yourself fit and fine when there is scorching heat outside in the summer months. So let us discuss something that is very important. So as summers set in, we are on for a little bit of a battle. No, I am not talking about anything that is very serious to bother you right away, but I am talking about precautionary things that would keep us better in the summertime to come. So as we know that when summer sets in, there are different diseases and problems that also come with it, and we have to be a bit careful about them so that we can spend our summers in a healthy way. As we are very familiar that summer takes us our gut health for a toss. We know that we have a lot of stomach upset, bowel upset because we are habituated drinking liquids and fluids from outside. We are used to having cut fruits from outside. We often venture out for our restaurants at night. So we have to be a bit careful on that. I would just come to that a bit later, but I would rather stress on something that can really land up you in trouble, and that is something that we call heat exhaustion, which can lead to something more sinister and serious, which we call heat stroke. About summer, something that we don't like is the amount of heat exposure that a human body usually encounters. Till a certain point of time, it is still acceptable, but if it goes beyond a certain limit or exceeds a certain limit, then it can cause serious health problems. If you are working in a profession where you are supposed to stay outdoors for a considerable period of time, and you are supposed to experience solar exposure for a very long periods, be very, very careful and take precautions which would protect you from heat exhaustion and heat stroke. Now, how would we differentiate between these two terms like heat exhaustion and heat stroke? तो वो भी आपको हम बता देते हैं कि heat exhaustion क्या है और heat stroke क्या है। अगर कोई इंसान को बहुत ज्यादा देर तक सूरज की रोशनी महसूस हो, या if the patient is exposed to solar light or sunlight for a very long period, or even say someone is spending a lot of time in the gym or other places where there is a lot of heat, then the patient might experience fatigue, the patient might experience headaches. There can be a lot of sweating, the patient might feel nauseous, the patient might have vomiting. So all these are basically signs of heat exhaustion. Now, then what is the difference between heat exhaustion and stroke? Heat stroke is the most severe form of heat exhaustion when the body loses its power or control to control its own temperature. That means that the normal balancing mechanism of the body, which we call the homeostatic system, is failing. How would we identify that? The core temperature of the body will rise above 40 degrees centigrade or 105 degrees Fahrenheit. The skin would become very hot and dry, and the patient would lose consciousness, would become confused and can even have convulsions. यानी पेशेंट बेहोश हो सकता है, पेशेंट का जो बर्ताव है उस पर परिवर्तन आ सकता है, पेशेंट का बॉडी का टेम्परेचर 105 डिग्री से ज्यादा जा सकता है, और पेशेंट का जो स्किन है वो बिल्कुल ड्राई हो जाएगा। तो ये सब सिचुएशन में हम लोग करेंगे क्या? Immediately what we are supposed to do is to take the patient to a relatively cooler place, a place that has got shade. जहां पे छांव है, ऐसे कोई जगह पे पेशेंट को हम लोगों को शिफ्ट करना पड़ेगा। उनका जो भी कपड़ा वगैरह है उनको उतार देना है। Any extra layer of protection has to be removed from the body, and we have to hydrate the patient. If the patient is unconscious, then intravenous saline or fluids would help. अगर पेशेंट बेहोश ना हो तो ज्यादातर जितना हम लोग उनको पानी पिला सके वो पिलाना जरूरी है, और बॉडी को कूल करना जरूरी है। दैट इज द फर्स्ट स्टेप दैट नीड्स टू बी डन। दैट कैन बी डन बाय आइस एप्लीकेशन एट अ रैशनल रेंज, मतलब बहुत ज्यादा आइस की एप्लीकेशन ना करते हुए जितना तक जरूरी है उतना आइस एप्लीकेशन या कोल्ड वाटर अप्लाई करके हम लोग शरीर को ठंडा कर सकते हैं। We have to move to a shady place जहां पे थोड़ा सा शेड हो, जहां पे छांव हो, और ये सब करने के बाद it is expected that the patient might just recover from the situation. We have to remember that heat exhaustion is still a position of recovery, but if the patient proceeds to a condition called heat stroke, then it is a very, very difficult situation to manage. So in the summers, we have to be very, very, very careful about the amount of solar exposure that we are getting. We are supposed to carry umbrella. We are supposed to carry a lot of fluids and water. Every opportunity that we get, we should try to look for shades. We should drink adequate amounts of water, try to wear whiter clothes or non-dark clothes, and limit our time of solar exposure. At times, as doctors, we also understand that there are practical problems that we cannot avoid. But जितना तक हम लोगों से हो सके, जितना हम लोगों का काम हम लोगों को परमिट करता है, हम लोग हमेशा कोशिश करेंगे थोड़ा सा छांव ढूंढ लेने का. वी हैव टू ट्राई, हम लोग कोशिश करेंगे कि ज्यादातर सूरज की रोशनी से हम बचे हुए रहे, सफेद कपड़े पहने, हम लोग छतरी का इस्तेमाल करें और जितना ज्यादा हो सके हम लोग पानी पिए. अगर हम लोग ये कर सकते हैं तो मुझे लगता है कि हम लोग यूजुअली हीट एग्जॉशन या हीट स्ट्रोक से खुद को बचा सकते हैं. और एक बात जो हम लोग को ध्यान में रखना है कि ज्यादातर एसी में रहना वो सबके लिए शायद मुमकिन नहीं होगा, पर अगर एक एम्बिएंट टेम्परेचर जिसको हम लोग बोलते हैं 24 से 26 डिग्री टेम्परेचर में हम लोग रह सकते हैं, वो अच्छा रहेगा. पर मुझे नहीं लगता है कि दैट इज एप्लीकेबल टू द एंटायर पॉपुलेशन. एंड वी ऑल्सो नीड टू बी केयरफुल अबाउट डिफरेंस ऑफ टेम्परेचर, लाइक फ्रॉम वेंचरिंग आउट फ्रॉम अ वेरी कोल्ड प्लेस टू एन एक्सट्रीमली हॉट प्लेस. तो ये सब अगर सतर्कता हम लोग बर्ताव कर सकते हैं, अगर वी कैन मेंटेन ऑल दीज प्रिकॉशंस, आई थिंक वी कैन प्रिवेंट आवरसेल्व्स from the effects of heat exhaustion and heat stroke.